Human scabies is a highly contagious disease caused by an infestation of the skin by a host itch mite, better known as Sarcoptes scabiehomous. Mites are small, eight-legged parasites. They are tiny, just 1/3 millimeters long, while burrowing into the skin, producing intense itching, which tends to be worse at night. The female mites are 0.3 millimeters to 0.4 millimeters long. The males are about half that size. Scabies mites can be seen with a magnifying glass or microscope. The scabies mites crawl but are unable to fly and cannot jump. They are immobile at temperatures of 20 degrees Celsius, although they may survive for prolonged periods at this temperature. They can only live off of the host body for only 24 to 36 hours under multiple conditions. The condition is severe, so outbreaks within the community can surely happen. Direct skin-to-skin contact is where it starts the stages of transmission. The impregnated adult female mite burrows into the epidermis, the upper layer of the human skin, laying eggs that mature in 21 days, causing this infestation you see. An infested person can spread these scabies even if he or she has no symptoms at all. It can be passed easily throughout the person's household or even the sexual partners, which is the adults is sexually required. Also can spread easily through crowded conditions where close body and skin contact is common. Biology behind this is a temporary cycle. The adult female mite deposit eggs as they burrow within the skin. The egg soon hatches, releasing larvae. The larva then molts into the nests that are found in the short burrow called molting pouches. After mating occurs, after the male penetrates the molting pouches of the adult female mite, the impregnated female leaves their molting pouches and indenture a burrow in which they lay their eggs. Sexual contact is the most common form of transmission of sexually active young members, and it is said that scabies is a sexually transmitted disease, though all causes are not sexual. Typically 10 to 15 mites, ranging 3 to 50, live on the host. Little evidence of infection exists during the first month. Symptoms may not appear until up to 2 months after being infested. Itching and skin rash are caused by the sensitivity to the protein and feces of the parasite. Severe itch, especially at night, is the earliest and most common symptom of the scabies. Itching and rash may affect much of the body or can be limited to certain sites of the infestation, such as between the fingers, wrists, penis, elbows, nipples, buttocks, and shoulder blades. The head, face, neck, palms, and sole are often involved in infants and very young children, but usually not adults and older children. Complications dealing with these symptoms is the intensive itching that can lead to skin sores, which can leave infected bacteria on the skin that can lead toward inflammation of the kidneys. Anxiety or hypersensitivity state may prolong symptoms even after the mites have been destroyed. Symptoms may persist with treatment failure, allergic dermatitis due to topical medicines used in secondary infections requiring antibiotics that can also cause persistent symptoms. It is critical to understand the scabies treatment process in order to prevent secondary infection, reinfection, and to effectively kill the scabies mites. Treatments consist of killing the mite, symptom control, and decontamination. The selection of particular medications may depend on several factors such as the age and overall health of the patient, tolerance for the particular treatment, and the severity of the infestation. Vigorous scratching may lead to a bacterial infection requiring treatment with an antibiotic. So treatment to relieve itching can also be important. Scabicides work by killing the mites, and some scabicides kill the eggs as well. Most often, a scabicide is prescribed as a topical cream or lotion, which is applied all over the body from the neck down. The most commonly prescribed scabicide is pyrethrum, which is 5%. Although the rash may not be present all over the body, patients are usually instructed to apply the cream to all areas of the body except the face. If infants are being treated, directions may include application of the cream to the scalp and head. Although the Scabicide medication is used correctly, can heal the rash and sore quickly. After the treatment is claimed effective, no new mites will develop. And though these mites are dead, the itching can still occur for a few weeks. There are no approved over-the-counter treatment that has been proven to eliminate the scabies mites. Also, Benadryl is very useful in providing relief from itching. Sometimes a short topical or oral medication is prescribed to help control the itching. Prevention and control. You should wash bed linens and bed cloths in hot water and by using the hot dryer cycle. Treat sexual partners and relevant family members. Avoid furniture touched by the infested person, as well as avoiding direct skin-to-skin contact. Items that cannot be dry cleaned must be covered or stored in a closed plastic bag for several days to a full week. Children and adults can go back to their primary daily lives the day after treatment. There is another type of scabies, which is crusted Norwegian scabies. It is a severe form of scabies that occurs in individuals with a weak immune system, elderly, or disabled. Persons with this have thick, large, crusted skin that contains large amounts of mites and eggs. The scabies can tend to take on a wart-like appearance. Individuals with crusted scabies are highly contagious and can spread the disease easily by the direct contact of the skin. The lesions are excessive and spread all over the body. But symptoms are a bit different from the mild scabies, which is the rash and itching. They should receive quick and aggressive medical treatment to prevent outbreaks. Rooms used by a patient with crusted scabies should be thoroughly cleaned and vacuumed after use. And I hope this gives you a better idea of what to expect when scabies appear in the prevention of the continuation to this mild to severe condition. Thanks you guys for watching.